Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician host, Dr. Tom McGovern.
I'm Dr. Chris Stroud, and this is the show where we and our guests will discuss relevant health-related topics and always from an authentically Catholic perspective. Now, Dr. Doctor is brought to you in part by the generous underwriting of our friends at CMF Curo. You can learn a lot more at mycatholichealthcare.org, and you can live your Catholic faith in your healthcare at CMF Curo.
Today, our guest will be heard across the EWTN Global Catholic Radio Network, and we have an emphasis on global today with Dr. Dermot Kearney. He's an Irish-born physician practicing in England, Northeast England, who has saved babies' lives by interrupting the abortion by mail two-pill process for dozens of women. And he suffered for his good work. I met Dermot at two different meetings in September, the annual Catholic Medical Association conference in Denver, and the following week in Rome at the quadrennial or triennial International Congress of Catholic Medical Associations. He is a wise, kind, and gentle man who demonstrates that dad humor does not exist only on this side of the Atlantic. I hope you enjoy getting to know him as much as I have, and I think if you're a guy listening, your wives will probably just be enamored by his Irish lilt. So, Chris, maybe we could start with a story that illustrates why Dermot's story is so important.
Yeah, sure. Let's start with this, Tom. You said dad humor, not bad humor, in case the listeners
I did. Dad, father, yes.
Connection. Yeah, because they're different. They're completely different.
There is.
Yeah, in this scenario, it's almost impossible to pick a story because there are just too many. It's story after story after story, and they're all pretty strikingly similar with slight variations, but they all go something, along these lines. A young woman finds herself most typically, I would say, alone, very frightened and feeling pretty isolated. And she's told by someone that the answer to all of her problems is an abortion. And then all she needs to do is take these two pills about 48 hours apart and her problems go away. Well, the reality is the baby goes away. Not her problems. But then something happens, magically almost, after she takes the first pill while waiting to take the second pill, and she changes her mind. Now, the establishment, our friends at Planned Parenthood and their international equivalents, will say, sorry, there's no going back. But listeners will remember we had a show some time back with Dr. Delgado of the Steno Institute. He's an author of a huge study looking at this very phenomenon. And he and we would argue you can go back and you can save this baby, or at least some of them. He published a landmark study that showed somewhere almost 70% of pregnancies could be saved by taking progesterone in between the first and the second dose and skipping the second dose for women who changed their mind. This study showed that it was safe for the mother, and if the pregnancy went on and it was successful, that it was really safe for the baby. So this idea of progesterone in pregnancy, we've been talking about for generations, and there's scientific literature going back to the 40s. That's actually older than you and I, Tom.
Yes, it is.
And progesterone poses absolutely no risk to the mom or the baby. Well, this should be, a no-brainer, right? Well, it's not the case. It's very controversial, as we're going to hear. But imagine a mom calling and saying that she's changed her mind, and that you prescribe progesterone for her, and an uneventful pregnancy happens as a result of that. You can imagine how good that would feel to allow that woman to successfully change her mind. And I've been
Chris, why does this matter to our listeners? Why should they enjoy listening to this episode?
Well, because there's a very good chance that you or someone you know or love is going to find themselves in a position like this. So there's a lot of reasons. I mean, it's an example of the government intervening and stopping a physician from exercising what he or she thinks is best for his or her patient. We take that for granted, but we shouldn't anymore. It puts policy and politics above the patient-physician relationship. And that's dangerous. And it's just another example of the government forcing a physician to do this, in this case, to not do this, with the political sort of wave of the moment dictating the right thing to do. And it's another example of a pretty sad anti-life, that is the culture of death, and how pervasive it's become in our society. So listeners, take heed. This is an important topic, and I think you'll learn a lot from our guest.
And I think you've actually done this with women, haven't you, Chris?
Yeah, I've been privileged to step into this role with a national network where women will call, they'll find us on the website, and we'll have the chance to prescribe the progesterone. And we've had some wins, we've had some losses, but we've had some wins, and they're sweet, sweet victories when they come.
And, we covered this on episode 204, as you said, with
Right.
Dr. George Delgado. So if people want to listen to it, but what are you hoping to learn now as we talk to Dermot about his story?
Yeah, in my own sort of way, I want to know what was it like to fight the government? You can't beat City Hall. Well, he did, as we're going to hear. What was that
Yes.
like? Where did he get the courage to do that? I'd like to think I had that courage, but I don't really know. Did he ever second guess his decision? And what did he learn from that fight that might help physicians across the pond, as we say, that very likely could find themselves in similar positions related to something we've talked a lot about, this so-called gender affirming medicine or other medical campaigns. So I really think that our listeners can learn a lot for themselves, and you may just learn enough to help your physician who finds themselves in trouble, just like this physician was.
That's great. I can't wait to unearth some of what's behind Dermot's story. And of course, we have our medical trivia question of the day. So I thought we would use the category of female sex hormones, and we have an expert here to correct me if I'm wrong in my question or answer. So the question is this: which of the following hormones that are typically associated with women plays the most important role in the production of sperm in men? And you have five choices. One of them is correct. First, A, estrogen, B, FSH or follicle stimulating hormone, C, luteinizing hormone or LH, D, progesterone, or E, prolactin. One of these plays the biggest role of the bunch in making sperm in men, but you're going to have to wait until the end of the show to get your answer. But we'll be back with Dr. Dermot Kearney here on Doctor after the break. Welcome back to Doctor for our special guest interview, and we're more special than usual tonight, going across the Atlantic Ocean to England, where we're talking with Dr. Dermot Kearney. Dermot is a cardiologist, but he also does general internal medicine call. That doesn't happen in the United States. He's the past president of the Catholic Medical Association of the United Kingdom, and he got his medical degree from University College Dublin in Dublin, Ireland in 1989. He did a general medical residency and cardiology specialist training in Ireland. Then he did interventional cardiology over in the Low Countries in the Netherlands between 2001 and 2003. And since then, he's been at Queen Elizabeth Hospital at Gateshead in Northeast England. So he's going to talk about an incredible experience he had with that entity known as the National Health Service. Dermot, welcome to Doctor.
Thank you, Tom. It's lovely to be here. Pleasure.
So Dermot, something happened in April of 2020, early in the pandemic, that changed the availability of abortion in the UK. What happened?
Yeah, well, first of all, the most abortions in the United Kingdom are now carried out by pharmacological means as opposed to surgical means.
Mhm.
And that's been the case since about 2014, where it just went over the 50%. I think the United States is still a little bit, I think it's just recently passed the 50% mark in that regard. However, the abortion providers are not happy. They want more and more abortions to be carried out. So a number of years ago, they appealed to the government to change the ruling, because the Abortion Act stipulated that abortions could only be carried out in a designated place, such as a hospital or a clinic. And they wanted that a mother's home, a patient's home, could be considered a designated place. So they managed a few years ago to get it that the second abortion pill, the misoprostol, could be given to the mother when she attended the first clinic. So she had to attend a clinic in person to get the first drug, the mifepristone, 200 milligrams, and she had to take it in front of the abortion provider. But then she would be given the second drug and instructed to take it either the following day or 2 days later to complete the abortion, and then a pregnancy test that she was to check about 3 weeks later. And that,
So Dermot,
has that
maybe
been the case?
I was just
Yeah.
going to say, Our
No,
listeners are
but there's a
probably,
change that happened in
Yeah.
April I wanted to
Yeah,
clarify
so in
here.
April,
yeah.
so with the COVID pandemic, that opened the door for the abortion providers to make it even more liberalized. So they claimed that women, it wouldn't be safe for them to go to clinics to pick up this first pill, to get the first pill. So they demanded and appealed that the whole process could be considered. That a mother's home could be considered the place where all abortions could take place, including the first pill. So they appealed for.
So Dermot, excuse me for interrupting. I was just going to say maybe listeners would benefit from you giving us a sense of sort of the abortion temperature, you might say. We're pretty familiar with what it's like here in America, but for the average person on the street, if you just struck up a conversation about abortion, what's that like there?
It's deeply ingrained. Abortion is considered by the vast majority of people to be a woman's right, a reproductive right.
Mm,
Having said that, the majority of people don't think about it, and it's not an issue that people in Britain are prepared to discuss very openly.
mm.
Some might have strong feelings one way or another, but it's only a very small minority on both sides of the argument. So the staunchly pro-life people like myself and the staunchly pro-abortion people are happy to engage in conversations to try to get their point of view across. But I would say at least 95% of the population would prefer not to discuss that topic. Having said that, if you asked most people on the street, they would say, "Oh yeah, well, it's a woman's right to choose." For example,
Mm.
I did a survey myself in my own hospital. I think you might find this interesting among doctors, and I think doctors are pretty representative of the general population, and they're not as well educated as we would like to believe, I'm afraid. I asked them a simple question first. I went just from ward to ward, taking opportunistic audit that I did. I asked this first question: in your opinion, should abortion be decriminalized? The vast majority said, "Oh, but it is decriminalized." So that's first of all, they showed they didn't understand the law because abortion still is a criminal offence in the United Kingdom. It must be carried out under the terms of the Abortion Act, or else it is a criminal offence. So that gave me the opportunity to discuss the legality and so on. But 85% of the respondents said, "Oh, yeah, it should be decriminalized." So then I asked
Mm.
them, I said, "Okay, if I ask the question in a different way, in your opinion, should abortion be available for any reason without restriction up to birth? Would that have changed your mind?" And 95%, so 85% had said, "Oh yeah, it should be decriminalized," but a whopping 95% said, "Oh no, 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 that can't be right." And they all had different reasons. Some,
Mm.
"Oh no, you can't go beyond 24 weeks," or "You can't go beyond the heartbeat," or "You can't go beyond sentience," or other sort of arbitrary time points that they had chosen. So it's interesting that, well, two things. First, it showed me that doctors don't understand the issue and the legality of the situation. But secondly, it showed that by, which we all know, by asking the question in a particular way in a poll, you can get whatever response that you want by just changing the question around. So, and I think that would be reflected that most people do not understand what abortion is. They would accept that it is a woman's right to have an abortion if it's her choice. But when you actually show them, for example, the videos or the pictures, that quickly changes the mind and the hearts in a lot of
Mm.
cases.
So, Dermot, when abortion became easier to come
Yeah,
by, both pills could be sent to the house of the mother. Did the abortion rate go up?
yeah, yeah.
And
Sorry.
how did you get involved?
Okay. Well, the abortion rate was going up anyway. So with I hesitate to call it medical abortions. I think medicine's a good thing, but drug-induced abortions, with the availability, then
Mm.
abortion became much more widely available and highly pushed by the abortion providers. But certainly there was an increase in the numbers of abortions being carried out once it became possible to do it without the inconvenience of having to go to a clinic. So that came about, as you correctly said, towards at the end of March, start of April 2020, with using the excuse as the COVID pandemic. Initially, it was meant to be just a temporary measure, but earlier this year, that has now become a permanent feature of the law. So I became involved in the abortion reversal process. We had started, or we had been thinking about this long, long before COVID ever came on the scene, or long before um, pills by post or telemedicine became a prominent feature of abortion provision. It goes back as far as 2014, sorry. I'm a member of as you said, of the Catholic Medical Association. I've been on their council since 2010. And at one of our council meetings in 2014, a wonderful man called Jack Scarisbrick, who founded one of the strong pro-life organizations in this country called Life. He attended our council meeting, and he had heard reports coming from the United States that while abortion by drugs was not as commonly performed in the United States, but already there were women who were receiving progesterone treatment in an attempt to save their babies after they'd taken the first mifepristone. He had heard reports of this. None of us knew anything about it because it was only established around 2012 by the Abortion Pill Reversal Network in the US. So he asked us, could we look into this? So we decided we would. We were a little bit skeptical, all of us on the council. There was about 15 of us there. We were concerned, first of all, could it actually work? Would it be effective? Because we'd been led to believe that mifepristone was a potent drug. It induces abortion almost immediately. So, even if you give progesterone, the antidote to mifepristone, would it have any effect? We were concerned about the possibilities of if the baby did survive, would there be some congenital problems, thinking of thalidomide and so on. So we quickly satisfied ourselves that wouldn't be the case when we looked into it in a little bit more detail. But we were determined that we would look into the issue. There wasn't a lot of information available, most of it coming from the United States, and just a few small case reports. But we also saw that there was opposition to the whole concept of abortion reversal treatment from the staunch pro-abortionists. Not a lot happened until about 2018 at our annual conference of the CMA. Another wonderful pro-life advocate called Claire McCulloch of Good Counsel Network in London. She came to our conference and she appealed with us that so many women were coming to them, having changed their minds after they'd taken mifepristone. Could we please do something about it? So having now got this second request, and this time more forcefully, we decided we had to really try and do something. So I went to the United States to meet George Delgado. I attended the US annual education conference in Dallas that year, 2018. Had the pleasure to go to George's talk on abortion reversal, met him afterwards, had a little talk with him and a few other people who had some experience in the area. I read everything I possibly could on both sides of the argument, and I became convinced, yes, this is necessary, and it's we have to do it. So that's how I got
involved. Dermot, I know listeners are questioning, because it's a subtlety, but really a big point that's worth pointing out is that, so the pro-abortion, we could understand why they would want women to take the pills. But what I think listeners would be surprised to learn is the vehement opposition to trying to help them if they change their mind. Yeah. Which isn't something that people, I think, would usually think. If you're decided to have knee surgery and then the day before the surgery you decided not to have the knee surgery, no one would really care. But put us in the minds of people in the UK. Why are the pro-abortionists opposed to the woman changing her mind midstream, so to speak?
It's difficult to know, and that is one of the arguments that we try to make. That if you're really pro-choice, as they claim to be, what's wrong with a woman changing her mind and having a different choice?
Sure. Exactly.
However, yeah. I think, and I'm pretty certain about this actually, because the clue comes from an interview done with Daniel Grossman. He's in your country, one of the most outspoken opponents of abortion reversal, and he has come over many times to the United Kingdom to speak with the abortion providers in this country. And I think they take their lead from him. In the interview, he claimed that it's nothing to do with the medication, it's the rhetoric. He says it's this rhetoric that women are changing their mind. So they have to try and convince us that this is not necessary. Women, if they decide they want an abortion, they're not going to change their mind. And in the United Kingdom in particular, when that issue is raised, we have to accept that women are changing their mind. Hundreds of them are changing their mind. For example, we had help between Dr. Riley and myself, who was my colleague in providing the service. We took 150 calls before we were stopped from doing so. And after, in the 9-month period when we weren't allowed to continue the service, we were made aware of at least 160 calls. So there are hundreds of women seeking this. And there could be more. And this is also a service that nobody knows anything about. It's not advertised. Nobody promotes it. Certainly the abortion providers don't tell women, if you change your mind, you can always get progesterone. So nobody knows about it. So these women were finding it themselves by desperately going online and typing in abortion reversal and getting helplines and so on. So we know that women are changing their mind. But then the question arises, if women are changing their mind, and if it's accepted they're changing their mind, why are they changing their mind? And we know the answer to that. That's very simple, and it's particularly more noticeable now with the telemedicine and the abortion pills by post, that they get no counselling. They get absolutely no counselling. They're given no alternatives to, like, nobody would ever suggest, well, have you really thought about this? We don't have a 3-day waiting period like they do in some European countries. So once a woman makes a phone call, she's basically posted out the pill straight away. So they get no counselling, they get no alternatives offered to them. They're not told anything about adoption or pro-life or crisis pregnancy centres that might be able to help them financially or emotionally or in supportive ways. So they get no counselling, they get no support, they get no alternatives offered to them, and then they get no follow-up. So if problems arise, they're told, oh, go to your local ER department. It's something to do with us. So go to your family.
So Dermot, were you stopped from doing this because a lot of patients complained about what you were doing?
No patients complained. No, not a single patient complained. And that's one of the strongest points in our favor that helped us in the end. In fact, we got.
But then who had a right to stop you? Usually it's patient complaints that stop a physician.
It's the regulatory authority can stop us. So we were stopped by the General Medical Council. That's the regulatory authority. But they can only do so if complaints arrive at their doorstep. So they got two, in my case, they got two specific complaints. One was from Mary Stopes International, the medical director of Mary Stopes International, who now call themselves MSI, Reproductive Choices, because they don't like the connotation of Mary Stopes being identified as their founder because of her racist and eugenicist background. They've changed the name to
like Margaret Sanger.
They've changed the name to MSI. So we wouldn't identify who MS is. So the first complaint came from them, and the second complaint came from the Royal College of Obstetricians and Gynecologists. And between the two of them, it was obviously an orchestrated attempt because the complaints arrived more or less on the same day. No patients complained, as I said. There were 10 allegations against myself. I won't go through all of them, but just to show you the stupidity and the absurdity of it. The first allegation was that I was prescribing an unlicensed medicine remotely. Now, first of all, progesterone is not unlicensed. It's licensed for use in various situations. It is not licensed for abortion reversal because no drug is licensed for that. So it's an off-license use. So what they neglected to inform the GMC and others and the media is that misoprostol, the second drug, is also unlicensed or it's used off-license. It's licensed for use in peptic ulcer management, but it's not licensed for abortion provision, whereas mifepristone is. So they neglected that. I also pointed out in my defense that methotrexate, quite a dangerous drug actually, is widely adopted and promoted by the Royal College of Obstetricians for medical management of ectopic pregnancy, but it is not licensed for that indication. It's licensed for rheumatoid arthritis and chronic inflammatory disorders, but there was silence met when I made those points. So that's the first thing. The second is that we were remotely prescribing, so in fact all of our consultations were by telephone contact with the mothers who were seeking help, and they contacted us. We didn't go looking for them. But again, all of the abortion pills are done by telemedicine. So that just shows the hypocrisy. And the silliest one of all is that in the number 10 allegation against me was that I was not following the NICE guidelines. And NICE is a very powerful body. It's the National Institute of Clinical Excellence that determines what standards of care in medicine in the UK. So I wasn't following the NICE guidelines on abortion provision. I wasn't providing abortion to anyone. They might as well have said I wasn't following
Right.
I wasn't following the NICE guidelines on rheumatoid arthritis management or chronic inflammatory bowel disease.
So Dermot, I mean, I think this is an international phenomenon, but physicians, we don't like to think that we're breaking the rules. We tend to want to stay within the lines. And it's a great fear, I think, of most physicians. I'm going to be called out by my peers for doing something that isn't right. What was that feeling like for you when, the entire national infrastructure comes after you like that and says what you're doing is wrong?
It was a shock the way it happened. However, I knew that someday we were going to have to explain ourselves, because we were doing something a little unorthodox. In what we were doing, it was a service that wasn't recognised by the National Health Service. There was nothing wrong with it. We knew that there was no law against it, and And I think it's very important to let you know, and for the listeners to know, that before we embarked on this, so in 2018, when we decided we were going to take this seriously, I had just been elected president of the CMA in the UK at that stage, and I was particularly keen to develop this service. And we decided we would go about it in the right way. We weren't just going to do it as outlaws. We were going to seek support from the governing body. So we wrote very respectful letters to the Royal College of Obstetricians and Gynecologists, to the Royal College of General Practitioners, and to NHS England, explaining to them the rationale for this wonderful treatment, how it can save lives, the evidence base for it, the safety data with it, and we got and could these organisations please support such a wonderful development? And the responses we got back were very, very disappointing. The Royal College of Obstetricians said they do not support an unlicensed use of medication. That's when I reminded them that methotrexate and misoprostol and so on were not licensed for what they were advocating it for. The NHS England said something interesting. They said that they weren't convinced by the evidence base, and they felt that expectant management was if a woman changes her mind, because they know they can't force a woman to undergo an abortion, so they have to accept that. But if a woman changes her mind after she's taken the first drug, the mifepristone, that the best that they could recommend was expectant management. That becomes very important when we'll probably talk in a few minutes about safety and so on when we come back to that, because that's a statement that could come back to haunt them. And
Well, I'm sure it's no coincidence, and I'm sure you're aware, the American College of OBGYN makes very similar statements. They say they go so far as to say it's unethical. And they base that on the studies. Many of the studies quoted didn't have the appropriate IRB and ethical observations done. But to say that it's unethical, I thought was really a reach, even for ACOG. But the same argument. So this is an international plot. It's not limited to either of our countries.
But after we wrote to those three bodies, and we wrote back a second time, but we got no further responses from them, and we wrote a third letter saying that we were disappointed and that we were going to go ahead with the service, and we presumed they would have no objection to it, and that led on to that what we did then. But in the meantime, we wrote to the General Medical Council asking that if a woman has taken the first abortion pill and she changes her mind and she approaches a doctor for help, what is a doctor supposed to do? So we thought that was a very genuine, good question for the regulatory body to help us with. And
Yes.
they gave a pretty non-committal but a reasonable answer. They said, well, we're not in a position to make clinical judgments because they're not a clinical organization, but they reminded us of their policies that all patients, including women in this situation, have a right to know all treatment options available to them and can change their mind and withdraw consent at any time. So we took that. Well,
Ooh,
okay. So they said, so they weren't
very
objecting to
good.
what we were doing. So, and then that's when we wrote the third letter to the colleges and said, we're going to go ahead with this. It took a little while to get it off the ground because then there was organizational. How do we actually get the word out there that this treatment is available? But we found a way.
And this is a good point. We need to take a break before the second half of the interview. Coming on Dr. Doctor, we'll be back with more of Dermot Kearney.
Welcome back to Dr. Doctor and our ongoing conversation across the pond, as they say. So, Dermot, help us understand. You made it. You got this letter, and they said stop doing what you're doing. At the same time, they said women deserve informed information, which is noble. But what were you stopped from doing in May of 21, and who kind of helped you through that?
Yeah, so we got myself and Dr. Riley. We got an email from the GMC, the General Medical Council, on the 28th of April to inform us that serious complaints had been made about our practice in relation to this service we had been providing, and that we were ordered to attend a tribunal, the Medical Practitioners Tribunal service, on the 12th of May, so within less than 2 weeks in order to prepare for it. And we were given details of the complaints and the allegations that had been made against us.
Now, could you have lost your ability to practice medicine as a result of that?
Not at that stage. I could have done. They have a process where these sort of cases have to be referred to what they consider an independent body, the Tribunal Service, which is part of the GMC in its own right. The members are trained by the GMC. But
Sure.
so they have to go to this tribunal, and then the tribunal will make a decision. So the tribunal could have decided, no, there's no case to answer here, or they could have decided to suspend us completely from medicine for a period of 18 months. That means we wouldn't be allowed to work anywhere in the UK as doctors. or as they did, they decided we could still work within our normal NHS jobs. For example, me as a cardiologist, but they put what they call conditions attached to our license. So in my case, the main condition was that I must not prescribe, administer, or recommend progesterone for abortion reversal treatment. They also stopped me from doing any voluntary work, any private work, which I don't do anyway. Dr. Riley was a little bit different because she's an obstetrician, so she. Sorry. So Dr. Riley's an obstetrician. So they didn't stop her from prescribing progesterone because she needs it for other things, but they stopped her from doing any voluntary work, any private work, and also that all of her clinical activities had to be supervised by somebody appointed by the GMC. So basically, they were just going out of their way to ensure that we would not provide this service by any means to anyone. So that and then that had to be reviewed at 6 months. So 6 months there was to be a scheduled a review, which again they couldn't take it any further. They could have dropped the case, and we actually appealed because in the meantime we got an expert witness to give a statement on my behalf. We got wonderful witness reports from many of the women that we helped. We got 10 very quickly. We got 10 excellent, strong supportive statements from the women. Again, I emphasize no women or their families had complained, and they all gave very, very glowing reports of my behavior, answering all of the allegations actually. But to our surprise, so we got an early review in August, and we were told in advance, this review has been called, because it wasn't meant to be for another 3 months. We were told this review has been called because of new evidence that has come to light, and we thought this is it, but they're going to drop the charges. And unbelievably, at the start of the tribunal, the chairperson said, "Now we're not going to look at any of the evidence. We're just here to look at the allegations once again." And my solicitors thought this was unbelievable because they're serious lawyers who work in proper courts of law, and they thought that this is we've got to take this into the proper secular courts, if you like. So at that stage, we decided we were going to have to appeal to the High Court, and that's when we started negotiations to take our case to the proper courts, if you like, out of the hands of the GMC. And,
so what did you feel like at this point? Did you feel attacked? Was this hard on you? Was it hard on your wife?
Yeah, Dr. Riley? It was probably hard. It was hard on Dr. Riley because I have to say I was very well supported and protected. Within 48 hours of the initial email, because I had to inform the various pro-life organizations that we have to stop this, we can't continue, and word got out to one of our organizations called Christian Concern, who immediately took me under their wing. I hardly knew them. I knew them sort of vaguely because I'd been involved with some pro-life discussions on abortion pills by post, but they suddenly decided they were going to, because they have a Christian legal center team, and they wanted to support me, as did ADF International, by the way. So people were queuing up to support us, which is great, pro bono, so we didn't have to pay anything to them. So they gave a wonderful service, and my initial reaction was, there's nothing we can do. We're powerless. The GMC have all the power. We just have to go along with this. And the CEO of Christian Concern, a wonderful lady called Andrea Williams, said, "No, this is unjust. We will not give up. We will challenge this, and we will win." And I said, "Well, okay, if you want." Eileen decided, because Christian Concern offered to help her as well, as did ADF International, but she, on legal advice, decided to go with one of the secular indemnity bodies, and they defended her. Their attitude was totally different. Keep your head down. Don't make this any worse. Don't challenge it. We know you're guilty, but let's try and aim for damage limitation.
We know you're guilty.
So in some ways, it was a little bit more difficult for Eileen. I got wonderful support, and Christian Concern then, through their networks, had prayer groups all over the world praying for me and for Eileen that this would have a success.
How about physicians, your colleagues? Did they line up against you, for you, or both?
Very few know anything about it. I wasn't allowed to, I was strongly discouraged from talking about it among my peers in my workplace. I had to go and see my medical director, who's basically the boss of all the doctors in the hospital. And he has a duty to care for anyone that is under investigation by the GMC, because doctors have committed suicide. Like this can be a very stressful situation for doctors, and 2 doctors in our region committed suicide purely on the allegations, even though they turned out to be false. So he was obviously concerned for my welfare, and he was very good. He said he knew absolutely nothing about the issues involved, but I had to go and meet him on a regular basis, and every time I'd go in, I'd say, are you okay? And I said, oh, I'm fine. He said, are you sure you're okay? He thought I should be trembling or in tears, but maybe I was naive, but I think it was the prayer and the support and the knowing that I wasn't alone and that we were doing something right. And I said to him many times, no, if we thought we had done something wrong, that we were harming people, then I would be worried. I would be very concerned. But if I get dismissed or suspended or whatever for doing something right, then so be it. My wife, you asked me about my wife. It was difficult for her
Yes.
because her concern was I'm going to lose my job, which I could have done, not immediately, but I could have lost it. So after 18 months, if things had gone according to the plan of the GMC, there would have been a hearing, and the hearing could have gone either way. So I could have been completely removed from the medical register, not allowed to work. The GMC.
So what short circuited it from going to that 18-month hearing? What stopped it?
The appeal by the Christian Legal Centre. So we wrote to the High Court in England, which would be similar to your Supreme Court. And we were, to my surprise, we were granted a hearing. So we only put the submission in at the end of September, start of October. I thought it would take years because there was a huge backlog with COVID and so on.
Yes.
But we were granted, surprisingly, a hearing the 24th of February. Now, of this year. So within a few months. So we started getting ready for that and preparing our witnesses and so on. In the meantime, the GMC had absolutely nothing. They had been desperately, or they said they had been investigating and looking for witnesses. We got lots of emails to say that they were having trouble finding an expert witness to support the case against me. We had got one within 3 days. Now, I would say the expert witness we got gave a very fair and balanced account. He is not under any obligation to me. I've never met him. I don't know who he is. He's an obstetrician. He performs abortions. He is not a Christian. So he had no sort of conflict of interest, if you like. His duty was basically to the court, to the tribunal service, to provide accurate information. And he gave a very, very strong supportive statement in what I had been doing. So that was very helpful. But even stronger were the witness statements from the women, because among the allegations was that I was forcing these vulnerable women to accept my pro-life beliefs, my Catholic beliefs. I would say that the Royal College, I want to emphasize this, the Royal College letter of complaint stated we're not so much concerned about the treatment, it's the people involved. And they pointed me, they said one of them is the president of the Catholic Medical Association, and then the other is an obstetrician who has spoken at pro-life events. So they were trying to point to the GMC that because we were Catholic and pro-life, we could not be trusted. And I think that I think was surprising that they put that in writing, because I think that may come back to haunt them. It was definite anti-Catholic, blatant bias, unfortunately endorsed fully by the GMC. They didn't say no, you can't go there, you can't say things like that. They endorsed it fully.
So what did the High Court do with that?
Yeah, so the High Court accepted our case, and they said yes, we'll have this hearing on the 24th of February 2023. The GMC has had nothing until just before Christmas. They suddenly managed to find an expert witness because they were now in a hurry. They had to get their documents in order, because you can't go to the court without some sort of evidence. You can't sort of say, well, judge will say, where's your evidence? And we say, well, we don't have any evidence, Your Honor, but we don't like what that guy's doing. And that doesn't hold up well in court. So they managed to get an expert witness, and his statement came out in mid-January. And surprisingly, to our surprise, it was quite supportive. It was almost more supportive of what I was doing than our own expert witness. Again, he was an obstetrician. I don't know what his background is, but he was an obstetrician who gave his opinion on what we were doing. He said that there was an evidence base, because one of the claims was that there was no evidence base for what we were doing. He said, no, there actually is an evidence base. It may not be a strong one. There's no randomized controlled trials, but there is an evidence base, and it's published in PubMed. And he was happy with that. He was happy that a cardiologist, despite what other people might think, there was no reason why a registered medical practitioner should not be able to prescribe progesterone, which is a safe treatment. He had no problems with that. His only concern was that because I had offered to pay for the treatment for some of the women who couldn't afford it, or who may not be able to afford it, and also for scans if they needed me to help them with scans. He was a bit concerned, was that bribery? But we pointed out that we weren't paying the women, we were paying the service. We were paying the pharmacist, basically. We were paying the ultrasonographer who was doing the scan. It wasn't going directly to the mothers. So
those crazy pro-life charitable Catholics.
Yeah, and charity is now a criminal offence, apparently, in the eyes of some. But yeah, so his report then came to the GMC. So the GMC now had to look at the evidence. So for the first time, they looked at the expert witness reports on both sides. They looked at the witness statements from the mothers. They looked at a number of other supportive statements that had been sent away on my behalf. And they looked again at the allegations against me. And they passed it on to their expert examiners that look at these things. And 6 days before the scheduled court appearance, they dropped the case. And the formal declaration was that they said that there was no prospect of finding any evidence to support any of the allegations that had been made against me.
Wow.
Interesting.
So, Dermot, I mean, in many ways, you were almost a martyr. We're glad that you weren't, but I'm sure you had that feeling that you might be martyred pretty soon. What was that like? How did that make you feel? It had to be frightening.
It was a little bit right. We had to start, myself and my wife had to start looking around at, if I do lose my job, which it wouldn't have been for another, we had about 18 months. We had until November 2022 when the full hearing was scheduled to appear if there had been no high court intervention. So we didn't actually go to court. So they dropped the case before we got to court.
But you were out there on the fighting edge as a Catholic, and I think most American physicians that we talk to, Catholic, would not want to be where you were. They would not want to be fighting the fight and waving the flag.
Yeah.
What was that like to feel like a Catholic on the edge in a pretty anti-Catholic environment?
It's always good to be a Catholic, so there's nothing wrong with being. So it's a good feeling to be a Catholic. I suppose the way I looked at it, and I was interviewed on one of you. There's a wonderful guy in Pennsylvania called Travis Rusko who does a podcast, and he came across my story on Twitter, I think, and he contacted me, and I did a little webinar or a little podcast with him, and he asked me that question. So a lot of our Christian listeners would want to know, like, how does your faith sort of sustain you and all of this? And I told him the way I'd looked at it was, and you probably know Patricia Heaton, the actress Patricia Heaton. She has been asked at a number of occasions about how is she one of the very few Catholics, pro-life people in Hollywood who is prepared to stand against all of the other sort of anti-life and anti-Catholic and anti-religious. And her statement really struck home with me a few years ago when she said, well, on the final day, it's not Barbara Streisand I'll have to stand before at the throne of judgment. And I don't know her. I think Barbara Streisand's terrific. She's a great singer and a great actress. But I knew what she meant, and that was the feeling I had. It's not the GMC, it's not the NHS that I'm going to have to stand before. So, I have this drive that as long as we're doing what's right, then we may have to suffer the consequences. We will have to suffer the consequences, no doubt about that. So. If the worst had come to the worst, if I'd lost my job, I wasn't allowed to work, I could do something else. It wouldn't be maybe as well paid. We probably would have to sell our house and live into a smaller little house, which may not be a bad thing. But so it wouldn't have been the end of the world. And if I was doing right.
So Dermot, because of what the GMC wrote, is it now easier for people like you, other people besides you and Dr. Riley, to prescribe high-dose progesterone for abortion pill reversal?
It should be. It should be because I wouldn't say it's a green light, but they have found that there's no case to answer in the specific allegations that were made against us. And if any other doctors had the courage to do what we were doing and do what we were, and the expertise and the knowledge to do what we were doing, there could be no case against them. All of the possible arguments against them have already been dealt with, and the GMC have basically dismissed all of the possible arguments, and they can't be resurrected again. They can't say, oh, we forgot to ask you this, or now if new information came to light. So if a woman did suffer some serious problem and complained, then they would have to take that. But that's extremely unlikely to happen, I would think.
But if they just do the expectant waiting, like they recommended, receive the first pill, not the second, can't they have high amounts of bleeding?
You see, that's the thing. You're probably aware of one of the arguments that they've tried to make against us is, as I said, initially they said there's no need, but that's obviously not true. Then they tried to say, well, it doesn't work anyway. Now we can give the example. We've got an over 50% success rate with the women we've helped. In the United States, there's almost 4,000 babies have been born. So we know that it works. It doesn't work all the time, but it works effectively compared to doing nothing or expecting management. Then they try to say now that it's dangerous, and they're basing that purely on a paper by Mitchell Kreinen, another outspoken opponent of APR, who was determined to show that APR doesn't work. So he set up this, I would say, bogus study or pseudo-scientific study, and he tried to show that he basically took women who were going to have a surgical procedure, a surgical termination of pregnancy anyway, and he persuaded them to delay it for 15 days. He was only going to use 40 women. Now, I can't think of any trial in history where you can show a significant difference between two treatment groups with just 40 subjects, knowing that at least 10% will drop out, and in something as controversial as abortion, probably 15 to 20% are going to drop out. But he was determined that this was going to be a valid study. So one half they'd all get mifepristone, and then the next day half would get progesterone, half would get placebo, and then he'd follow them up for 15 days. And at 15 days, surprisingly, 4 out of 5 of the women on progesterone group were still pregnant at 15 days, 80%. And in the placebo group, 2 out of 5. So that was demonstrating that there was a doubling of survival with progesterone, which is what we've been saying all along, basically. Now, we know that if you go on beyond 15 days, there will be more losses. But it was at that early stage, it was showing a significant survival advantage with the active treatment. It also showed that 2 women with the placebo had a significant hemorrhage, one of whom required a transfusion and the other required a surgical intervention. And one woman in the progesterone group had a bleed. She attended her ER, was checked, assessed, blood pressure was stable, hemoglobin was stable, and she was discharged home without any need for any intervention. So we're showing not only was it more effective in survival in terms of fetal survival, it was also safer, and that was likely to cause less hemorrhage. And I suspect that the organizers of that study and the researchers didn't like this was not supposed to happen. This was meant to show that there was no difference between progesterone.
It's amazing that ever saw light.
So they had to find some reason to stop the study early. So they said, 3 women have had a hemorrhage, had to attend ER. This is unsafe. So then they're out there. so they're in their discussion, they said, well, we can't extrapolate what might have happened after 15 days, and maybe there would have been different outcomes. They said it was just too dangerous. So the main point of the study in their eyes was that if a woman takes the first abortion pill but doesn't take the second pill, the misoprostol, then she's at major risk of hemorrhage. So expectant management. Now, that's what NHS England are advocating, that, expectant management is the right thing to do. But if they go with that, then they're directly contradicting what Mitchell Kreinen is saying. So they're contradicting each other. That it's on the one hand, they're saying that's the only thing you should do. You shouldn't get progesterone. That's dangerous. But on the other hand, they're saying if you don't take misoprostol, that's dangerous. So they can't have it both ways. So they either expectant management is good or it's bad. We would advocate it. So there's a third option here. You can take progesterone. We know it's safe. It won't do any harm. It might improve the chance of fetal survival, and it might reduce your risk of serious hemorrhage.
30 seconds left. What do you want to leave our listeners with, Dermot?
Have the courage of your convictions. Don't ever get tired of doing what's right. You know in your heart and in your conscience what's the right thing to do. Don't be afraid. You have nothing to be afraid of. All these things pass. Any trials, tribulations come your way will pass. And we know what the final outcome is, and we want to be on the right side.
Dermot, thanks for being with us on Dr. Doctor. I hope thousands of people are encouraged by your wonderful story.
Well, welcome back to Dr. Doctor, and welcome to the answer of this episode's medical trivia question about what else? Hormones. It just doesn't get any better than that. Which of the following hormones that are typically associated with women in discussions like this plays the most important role in the production of sperm in men? This is a tricky one, Tom.
It is, because we talked a lot about progesterone, so people might think that's the answer, but it's not. So which one of the other 4 is it? Estrogen, FSH, LH, or prolactin? It actually happens to be FSH, follicle stimulating hormone. So how in the world can that be, Chris? Because men don't have follicles.
Yeah, well, it should be called something else in men, but it's not. It's called FSH, and it's the same hormone that is called FSH in women. Ironically, we're not that different sometimes, but it has a dramatically different effect. So FSH comes from the pituitary gland in the brain, and it stimulates in men the testes, which are analogous to the ovaries in women, but the
Right.
outcome is not eggs. It's men's version of eggs or gametes, uh, which are called sperm. So it's not testosterone, because when you hear men and hormones, everybody thinks it's always testosterone. In this case, it's actually not.
Wow. But it works with testosterone to make those sperm. So
That's
enough of that. And now, what are your top 3 takeaways for this episode, Chris?
Well, one is I want to go visit the UK and talk to doctors. It sounds like a pretty exciting place to be. But I love it where you said, never tire of doing what's right. Isn't that great advice for every physician out there, every healthcare worker out there? If we could just adopt that attitude of let's do what's right, and we're not going to tire of it regardless. The other is the forces of death. I mean, this culture of death, it's not limited to America. This is international. And I think he did a great job of portraying how pro-abortion the culture is there. And then I also thought it was interesting, Europeans respond the same way as North Americans do. When you actually show them pictures of what's happening, they suddenly realize that's not what I thought, and I'm not in favor of it anymore.
Right.
And then lastly, a very practical point, this works. Not every time, but progesterone in between the 2 dosages can save lives. And so you can direct, if you just type into your search engine, progesterone and abortion reversal, you'll find a national web, literally, of people that you can talk to, and you can be assigned a healthcare provider in your area, and you can get this treatment, or someone you care about who maybe has made the mistake of taking the first dose, they can get this treatment and lives can be saved.
Yep. The Abortion Pill Rescue Network, of which our good Dr. Chris Stroud is an important node or part in it. Well, thank you for listening to us and for listening to Dermot Kearney from the UK. We hope to get some more international guests here on Dr. Doctor. And if you want to listen to other episodes, you can do so on our website, drdoctor.org. Just click on episode archive at the top, where you can search over 200 episodes by topic or guest.
And if for some unexplainable reason you'd like to see us as well as hear us, just click on the YouTube link near the top of the homepage at drdoctor.org. Also, if you've got a question or you've got an idea for a guest or an episode, we'd love to know about it. And just click on Submit a Question there on the website.
This is Dr. Tom McGovern.
And this is Dr. Chris Stroud. We're signing off until your next dose of Dr. Doctor.